All right, we're going to go ahead and get started. Good evening, everyone. Thank you again for joining. We're so excited to have this webinar this evening. I'm Angela Marshall, President of Montgomery County Medical Society for this year. And on behalf of MCMS, I welcome you to this important webinar about the vast resources offered by the Montgomery County Health Department. We really appreciate the collaboration with Dr. Davis and her staff on this valuable webinar. So thank you all in advance. Often as physicians, we want the best for our patients, but we realize that much of what keeps them healthy can be found in their own communities and from resources like our own Montgomery County Department of Health and Human Services. So tonight, we're very pleased to learn more about these services and how we can connect our patients to these resources in our county in order to improve their quality of life. Before I introduce our speakers, I do want to remind you all of a few upcoming events and activities of MCMS. On next Tuesday, October 17th, we have a 30-minute lunchtime briefing for practice managers, staff, and physicians. So hope to see a lot of you out. And again, your staff is welcome. And the title of next Tuesday's lunch break webinar is In or Out, Evaluating Whether to Outsource Medical Billing. And the speaker is Megan Browner, who is the medical biller at Healthcare Data Management, a strategic physician connect partner. So we hope that you all will show your support and come out to that webinar next week. On Tuesday, October 24th, we have a virtual fall general membership meeting scheduled. And following our business meeting, we have a guest speaker, Kimberly Lomas, who's a physician with the American Medical Association, who's going to talk about the impact of artificial or augmented intelligence on the practice of medicine and in medical education. So this should be a really exciting topic of discussion. So hope to see you all there. It's open to all members of MCMS. And then on Saturday, October 28th, we have the Met-Chi House of Delegates policymaking body in person at the hotel at Arundel Preserve. And so for those of you who haven't heard, we are submitting 17 resolutions this year, which represent the concerns of our members. And I want everyone to know that we took the painstaking process very seriously, as we always do. But this time we had several listening sessions to make sure that we truly captured the concerns of our members. And so we hope that we will get your support. And if you have any interest in being a delegate for that meeting and you're an active MCMS member, please contact Susan right away, because she does have to submit those names really soon. And last but absolutely not least, for announcements, we have on Thursday, November 9th, an in-person event to be held for the Women in Medicine. And this is the Red Dress event. So ladies, if you haven't gotten your dresses, make sure you get those together for November 9th. It's going to be held at Waverly Street Gallery in Bethesda. And it's open to all women physician active members to come and enjoy some collegiality with the backdrop of really interesting and beautiful art. You can sign up for all of these events on our website at montgomerymedicine.org/events. And if you're not a member, as you can see, we've got lots of exciting things going on. There's still time to sign up for this year. So please email Marissa Valeri at mvalerie@montgomerymedicine.org if you'd like to join, or if you'd like to refer a colleague to us who you think would be interested in joining. And remember, when you join MCMS, you're also joining MedChi, so you essentially get 2 memberships for 1. Now, on to our important program for this evening. Our speakers this evening are Dr. Keisha Davis, MD, MBA, who is our Montgomery County Health Officer, and she has hit the ground running. And so we're so excited to have her here today. And Dr. James Bridgers, MBA, Director of Health and Human Services. He also holds a PhD. After they present, we will have an opportunity for questions and answers. So please put your questions in the chat so they can be addressed. And just a reminder, this program is being recorded, so we ask that you continue to mute your microphones, and we will make the recordings available to you as well as to our colleagues and your staff very soon. So with that said, I'd like to personally invite Dr. Bridgers to kick this off, and thank you both again for joining us.
Dr. Bridgers,
you're
you're
still
on mute.
muted. Yeah.
So let's try this again. Thank you, Dr. Marshall, for those warm remarks. Can you hear me now?
Yes.
Great. Thank you for the thumbs up. So it's been a while, maybe a year and a half, since I've had the pleasure to speak with the members of the Medical Society of Montgomery County prior to Dr. Davis joining us. I served in that position, and it's great to have a practice partner such as Dr. Davis, who will lead you through the slide deck. I now wear another hat, literally, as the agency's Director of Health and Human Services. So I welcome the opportunity, the feedback, the camaraderie, but also welcome you to this webinar in which Dr. Davis, as I indicated, will lead us through and talk about some of the services and the overview of those services that are available through the Department of Health and Human Services, but more importantly, talk about strengthening our partnership. We welcome the opportunity to partner with you by offering this presentation as well as a forthcoming newsletter service. So all of that to say is that we look forward to this call to action. Our partnership is most vital to our community members to look at benefits. So when you talk about access to care, patient navigation, you know, an enormous and can be an overwhelming phenomenon in our emergency departments. This is where the Department of Health steps in, Health and Human Services, and not only provide those clinical resources and support mechanisms, but also those behavioral health and somatic care. So we look forward to that robust relationship. We pride ourselves on being one of the healthiest counties in the United States, and especially in the state of Maryland. And we couldn't do that without you and the members of our medical society in Montgomery County. So I just wanted to share those thoughts with you, to talk a little bit about where we're going, that Dr. Davis will illustrate as she walks through the slide deck. We have about 60 slides, but of course we're not going to go through all those slides. We want to have an opportunity for you to ask us questions and provide those answers. And if we don't have the answers to those questions, rest assured, we will get back with you, or even have a work session to talk about some of those strategies that we would like to share as a result of our community health needs assessment, what Dr. Davis will talk about. So again, thank you for joining our webinar this evening in partnership, and we look forward to a robust dialogue and presentation. Thank you, Dr. Marshall. And now I'd like to turn it over to Dr. Davis to kick off the webinar and walk through the slides as we present some of the capabilities within the Department of Health and Human Services.
Thank you, Dr. Bridgers. As Elizabeth is bringing up the slides, I just want to say, so Dr. Bridgers and I work really well together, but how valuable it is for you all to have Dr. Bridgers as director. You all got to know him during COVID. And so to have somebody who's sitting in the director's seat, who has, you know, come through COVID with us, but understands the importance of that communication and collaboration that it really takes from the docs who are on the ground. So I am really lucky, you know, I came in and he just shot up the ladder to become my boss. And so I am better for it. So we are really lucky to have you in that position. So glad to have you.
I'm your partner
That's right.
in this
And my
practice.
boss,
And this is
but that's okay. That's how we are. That's just how we do. But so, you know, part of the reason for this, I thank Dr. Marshall and Susan and folks for inviting us here. Part of this is because I practice in the county. I'm a family physician. You know, was part of a practice in Gaithersburg. For those of you who know David Fogel and Alana Barlavov, Casey Health, was with them. And I know when I was there, I had no idea what the health department did other than call them if you think somebody needs a rabies shot. And so thinking about being in this position, there's so much overlap and so much, if we're really going to advance the health of the county, I need to be working with the docs who are on the ground, who are seeing folks, who are really delivering that health and healthcare to people. And so this is just a very first preliminary initial conversation about what some of the things that the local health department does. This will also kick off a series. We'll start putting things in your newsletter of information about the county, about the health department, about how you can engage, and really what are the things that might be beneficial for your patients to refer them to, but also just understanding the health of the county and what that looks like. I would love to come back at some point and, you know, potentially share with you the community health needs assessment and what that looks like. So you can go to the next slide. And so our goal here is really just understand the health department, consider some of the health equity implications of the programs and services, and how we can complement each other. Really, in short, what we do, how we help, and what lies ahead. So the county executive really has 7 priorities, and many of them really touch the social determinants of health and how we think about health. So thriving youth and families, a growing economy, a greener county, easier commutes, more affordable and welcoming county for a lifetime, safe neighborhoods, and effective sustainable government. And so when I think about what builds a healthier community, these are the things. Yes, it's important to have health insurance. Yes, it's important to have access to a healthcare provider, to have access to a physician, to have strong hospitals in your community like we do. But if you don't have an environment that allows youth and families to thrive, if you don't have an environment that has safe neighborhoods, if you don't have an environment that has affordable housing, then you can put all of the best docs on every corner and you're still going to keep having those issues. And so you really need to be thinking about how we build healthier communities so that we are presenting healthier patients to your doors. The next slide. And this is talking about the DHHS vision. I can talk about this, but Dr. Bridgers, I don't want to rob you of the opportunity to talk about your director priorities.
Sure. Thank you, Dr. Davis. And so looking at my priorities, a couple of things. We are realigning our current strategic roadmap. I've been, Dr. Davis and other senior and key leaders in the Department of Health and Human Services have really been looking at our access to care, even our earlier discussions about access to treatment modalities and vaccines. When we had ARPA money and FEMA money and other federal level money, we could do a lot with the community and supporting the communities and our medical partners and practitioners. But now that's a challenge for us. So we really need to look at those navigational points and how we support those navigational portals through the Department of Health and Human Services. And then equity. Equity is always a challenge to make sure that we are supporting those members of the county and the community who are at risk, at greater risk, as Dr. Davis would say, across the generational lifespan from birth to death. And so looking at equity in all spaces, as part of that painless navigation plan. We want folks to be trusted. We want our services in the Department of Health and Human Services to really focus on person-centered access from a holistic approach. And then an effective and supported workforce to ensure that our workforce is culturally humble, that we have the level of health literacy in the community, that we have those community connectors, those peer educators in the community, especially around the increase in fentanyl use and substance use disorders in our adolescent population. So working with our pediatricians and those practitioners, our mental health specialists, our psychiatrists, psychologists, social workers, to really look at providing the workforce that's really going to look like the community, be trusted in the community, and work very diligently in the community. And so back over to you, Dr. Davis. But those are my immediate priorities, and they may change. I am constantly evaluating those priorities using best practice, evidence-based models. And so we will continue to go down this road and endeavor to make my priorities from the director's position more robust and more aligned with the community needs.
Yeah, especially as we start on that strategic planning process and bring that vision to the rest of the county. I want to share a little bit about what Montgomery County looks like. What I found is was the longer that I was in practice, the more my patient population started to look like me. And that helping to understand what this county looks like, I think, is really important. And looking at how the county has changed. So you can see how much this county has changed in terms of diversity going from 1960 to 2020. 1960 was not that long ago. Many of you were alive in 1960, maybe not practicing, but you were around. And seeing the demographic shifts that have happened over those 60 years is pretty dramatic. To go from a 96% white non-Hispanic population to a 40% white non-Hispanic population is pretty dramatic. What I want to say, what I'm most proud of in that is that through that transition, Montgomery County continues to be #1 in the state for health outcomes. And so a lot of times people bemoan the fact that, as communities change, those health outcomes change. Our health numbers are still quite strong. However, when you look underneath the hood, those disparities do come into play. But Montgomery County continues to be the most diverse county in the state. You can see in Maryland, about 16% of Maryland residents are foreign born, as opposed to about 33%. So about a third of Montgomery County residents are foreign born. English is spoken in about 60% of households. We see quite a bit of Spanish, other Indo-European languages, Asian and Pacific Islander languages, and other languages. There are about 130 different languages that we keep track of in the county. And so we just keep diversifying how we make things available, from Spanish to Chinese to Vietnamese to Amharic to French. You name it, it's part of the onboarding that we go through at DHHS in what our language services are and how we access them, because we don't want that to be a barrier to folks being healthy. Interesting fun fact, our largest ethnic groups are El Salvador, mainland China, India, and Ethiopia. And another fun fact, Montgomery County has more immigrants from Ethiopia than any other place in the country. So lots of good Ethiopian food here, and there's quite a thriving Ethiopian community here in Montgomery County. Go to the next slide. So this is also a place of great income and educational diversity. So when you look at Montgomery County, the median household income is about $113,000 as opposed to about $90,000 in Maryland. When you look at high school graduation rates and kind of The county as a whole, this is a very well-educated county. 61% have a bachelor's degree or higher, which is pretty remarkable. But when you look at the disparity that exists within that, so only about 28% of our Hispanic population and only about 47% of our Black and African American population have a bachelor's or advanced degree. And I think it's interesting, when you look at the percentages with no high school diploma. I call out, 10% of our Asian community doesn't have a high school diploma. I think they are often forgotten about in that conversation. Because while there is a high rate of folks that have those bachelor's and advanced degrees, we do have a significant portion of our Asian community that doesn't have a high school diploma, and they sometimes get left out of those conversations. When you look at the income of the county, incomes below 50,000 versus above 50,000, and you really see that disparity for our Black and Hispanic residents. It's about half and half, those who are above and below, as opposed to what you look at for the county as a whole, for Asian and our non-Hispanic white populations. When you look at going back to our median income and how much it costs to get around, to think that, a third of the population is not just less than the average, but well less than half of what the median income is. That is quite significant, and you really recognize, it really just puts a sharp light on the amount of income diversity or inequity that exists within the county. Next slide. So this is just kind of a snapshot of poverty where it exists. So you can see on the left, the darker areas are the lower median incomes, and the more green areas are the higher median incomes. And you can see how that kind of breaks out along the county. I will highlight the dark area on the left, the western upper Montgomery County, the agricultural reserve, the Poolsville area. I will highlight that. I think there's a perception that Poolsville is a rich white area with no inequities and everybody's rich. And I just want to highlight that it's kind of median income and maybe less. And that agricultural reserve is an area that actually we're starting to see some health disparities that exist there too. And we often think of our down county or east county areas, but we forget about the inequities that exist in that area as well. The self-sufficiency standard is a standard that looks at what should be the income that's needed to make it in the county. When you look at real costs of daycare and food, the federal poverty limit is based as a national standard. And so when you look at what the real costs are in the county for a family of 4, they would need an income of about $91,000 to be above poverty level. However, the actual federal poverty level for a family of 4 is closer to around $40,000. And so that gap in the services that they are eligible for and how much it costs to actually survive in the county is pretty great. Next slide. So what does the health department do? Like, why do we exist? What do we actually do? And our goal is really strengthening our overall quality of life by addressing the social determinants of health, trying to move those barriers out of the way. The next slide, I'm sure you are all very familiar with social determinants of health, what they are. We talked about them a little bit in the beginning: climate, nutrition, healthcare access, education, income, neighborhoods, choices in our behaviors, race and the experience of racism. All of these things, many of which exist outside of our exam rooms, contribute to the health of the patients that we serve and the residents of the county. And so HHS is really working across the lifespan. You can go to the next slide, in these different areas, from preconception to birth, to school age, to thriving, healthy families, adolescent, and all the way through to have, thriving folks who are thriving in their senior years. Montgomery County is also a place that has has really healthy aging communities. And that's a wonderful thing. We want to make sure that our communities here are able to age well. And so that is a benefit that we have, but we want to make sure that we are continuing to help people to age gracefully and have those resources in place all across the lifespan. So just a snapshot here of what the health department looks like. So there are 5 main service areas: children, youth, and families, aging and disabilities, behavioral health and crisis services, public health, and services to end and promote homelessness and prevent homelessness. Those are all supported by a series of other functions. So the chief operating officer, social services, which is also a subset of children, youth, and families. That includes child welfare, all of our eligibility programs like supplemental nutrition assistance, WIC, those programs. Our PACS team, planning and analytics, which helps a lot with our data. Our Office of Community Affairs, which really in a lot of ways is our eyes and ears out into the community to make sure that we are not just sitting in the ivory tower thinking about what we think we should do, but really engaging with the community and making sure that we are planning and programming together to meet their needs. Governance, risk, and compliance, because everybody needs to make sure that we are compliant. And then our legislative coordination, which helps to coordinate with the council, with our state delegation, and with our national elected leaders. And so I'm going to just run quickly through each of the service areas. There's a lot on these slides. We can send them out to folks later. Really what I want to get to is having a conversation about what services exist, how to access the health department, and how we can be a resource to each other. And we can always talk about COVID at the end. But aging and disability services, the chief is Dr. Patrice McGee. Community support for folks with disabilities, the area agency on aging, and adult protective services and case management. This is who you would call if you had an elderly patient who lives by themselves, who normally is doing okay, and they come into a visit disheveled, and you're concerned about memory problems, and maybe they don't have kids close by, and you're worried about what's going on with them. Adult protective services could potentially be a resource to that. Many of you may have heard about one of the senior memory care facilities that's closing down, the Landing in Silver Spring. The long-term care ombudsman has been working with the residents there and working with the facility in the transition and trying to be kind of a voice and advocate for them. And our kind of support for folks with disabilities, respite services, autism waivers, helping with employment connections. So that's just a snapshot of some of the things that are really trying to help those communities to live their best life here. Next slide. So behavioral health and crisis services. So this encompasses our local behavioral health authority, which helps connect folks to care. It also encompasses our crisis services. So we just opened a new 4-bed diversion center where folks can come if they are having a mental health crisis, or they, it's got 4 chairs. They just need to chill out for a little bit to avoid potentially going off to jail or to the emergency room. We are working on opening a larger diversion center that hopefully will be, the funding's been approved, just the building just needs to be built. So in the next few years, it will be able to expand on that model. 240-777-4000 is the number to call for any crises from a behavioral health nature. It also encompasses our substance use harm and prevention. We have several services related to harm prevention, a lot of them focusing on opioid and fentanyl use, but also we have syringe and needle exchange programs. We have fentanyl test strips. We have Narcan that is delivered to folks. We do lots and lots of training, and we do lots and lots of partnerships with schools and community organizations to really increase prevention and get to folks before they even start using drugs in the first place. So that has been really important, that it's not just about those later services, but really making sure that we are increasing opportunity and availability of the prevention services. Children, youth, and families. So positive youth development. This includes our street outreach network, which does a lot of gang prevention, reaching out to at-risk youth and really talking to them on the street, you know, engaging with youth, going out and in an area that seems hot, talking to folks, diffusing situations. And they have been really successful in helping to calm down violence in certain areas and really interacting with youth and engaging with them. Children and adolescent services and school-based services. This works a lot with MCPS. On many of the school-based services, we have lots of programs, linkages to learning, cluster projects, lots of things that we do with the schools in order to help kids. Early childhood services, Office of Eligibility and Supports, again, that's SNAP, and many of the nutrition assistance programs, and then child welfare services, which, again, unfortunately, if you have a concern about a patient, that's who you're calling, Child Protective Services to help investigate a situation. They also handle adoptions and foster care. We can go to the next one. And so the Office of Community Affairs, as I was saying, this is the office that's really, in a lot of ways, our eyes and ears and hands out in the community, especially our multicultural health program. So we have an African American health program, an Asian American health initiative, and the Latino health initiative that really does a lot of work interfacing with the community and having that level of trust. They were essential during COVID. When you look at our initial vaccination rates, we were some of the best across the country, and we did it without a disparity. And it was really because those programs went out into the community and they were that trusted voice to say, yes, you should get this vaccine, and I'm going to bring it to you. I'm not going to have you go to some sterile building with people you don't know. I'm going to bring it to your church. I'm going to bring it to your community center. I'm going to bring it to your civic group. And we continue to lean and pull on them to really get messages out. So they continue to amplify our COVID messages. They've also been working on some of our fentanyl issues, and really being that trusted partner in the community. Public health services, which is near and dear to my heart, near and dear to Dr. Bridgers. So community health services, I'm going to brag a little bit on our healthcare for the uninsured program. So Montgomery Cares, Care for Kids, our dental services, and what was the maternity partnership all provide healthcare access for folks who don't have insurance. We are unique in the state in that to do it in the way and in the scale that we have. I think I saw some of our Montgomery Cares partners on the call, and this really has allowed folks to have, I don't want to call it insurance because it's not insurance, but allowed them to have a connection with primary care and mental health and dental services that they didn't have previously. Our maternity partnership provided coverage for prenatal care for women who didn't have insurance, and we're really excited that now the state has expanded Medicaid access, and so women, regardless of citizenship status, can get Medicaid if they're pregnant, which means the county, don't have to pay for it anymore. But we continue to support those women, those patients that were part of the maternity partnership, by helping them get signed up for Medicaid, and continuing to provide that home visiting and additional touches to make sure that they're being successful. This also includes our communicable disease and epidemiology. So our HIV and STI programs. We just last week opened our a new HIV STI center in Up County in Germantown. We had one down in Silver Spring on Dennis Avenue. We're really excited to bring that resource up to Germantown. There already was a dental clinic there, but we're excited to be able to expand those services. We also provide immunizations to folks without insurance. And these are the folks to give a pat on the back because they were our heroes during COVID and led the emergency response and all of the efforts that went on there. They also deliver our TB program. Licensure and regulatory services. So these are like the unknown, unseen champions of public health. So when you think about public health, what does a community need to be healthy? You need safe water, you need sanitation, and everybody forgets about that. And so these are the folks who inspect our pools and inspect our restaurants and make sure that the food that we are eating is safe and the pools that we swim in are safe, and do a lot of that education with the community. And so they are truly the unsung heroes. You know, when something goes wrong, when somebody gets hepatitis A from a restaurant, you know, everybody gets upset, but all of those cases that were prevented, I don't think we've had a case of Hep A in the county not since I've been here, not for a really long time. Health planning and epidemiology, certainly really important to everything that we do, and school health services. So I did not realize that all of the school nurses, and we have nurses in each school, are actually employed by the health department, not the school system. So they all work very closely with us in providing that support to the schools. There's also, I believe it's 16 or 19 school-based health and wellness centers that have a full clinic. So they are currently in a few elementary schools and a few high schools, and that will be expanding. So that provides more than just your traditional health realm. So they can come and they can get their school physical there. They can come get evaluated for a headache. They can come have a regular checkup and then go back to class. So they're not missing school for some of those more routine health visits. So we're really excited about the ability to have that there. And the last service area is services to end and prevent homelessness. And so we do a lot to prevent folks from becoming homeless in the first place. So there's a lot of housing and stabilization services, eviction prevention, home energy assistance for folks who can't afford their energy bills, for families that have minor children. We do a lot, rental assistance to try and keep people from having to be in a situation where they are on the streets. We do outreach for folks who are homeless, and we do provide transitional housing. So we have several shelters that we operate, but we also have permanent supportive housing. And so really try to do that whole continuum of preventing someone from becoming homeless, outreach to them if they are homeless, and then trying to get them into housing. All right. And one thing, a really nice example of a public-private partnership is the opening of the respite center with the for our shelters. So there was a need that we saw in the hospitals where there's a patient that's homeless and they need to be discharged. And if they had a home, they could have been discharged, but maybe they need wound care or IV antibiotics that could be given at home. But if somebody's homeless, even though that's something that could easily be done, you can't do it on the street. And so Nexus Montgomery came together and with funds from the county government and private funds, they were able to open a respite center. And so that creates the ability to transition folks from the hospital who aren't meeting the level of inpatient care, but can't quite be on their own yet. And so that is a really big benefit to that. And slide. And so talk about what the future holds. And Dr. Bridgers, I don't know if you want to talk about what the future holds for HHS. I think it's bright, is what I'll say.
Sure, it is. And so thank you for walking us through the slide deck and all of the many service areas. Dr. Davis, thank you for the time and effort you've put in to really get a sense of the needs, the clinical needs, but also the human services need in the agency. And this picture depicts our outreach and strengthening of our community relationship with the Mary Center. And they open up a dental clinic and looking at not only expanding those dental services in the Silver Spring area, but also in Up County, and one of the things we didn't really talk about was having the access and increasing access. I briefly touched on it when I did a brief overview of my priorities, but looking at increased access. So the mobile clinic and the work we want to present to the community with the mobile clinic and being able to go deeper and penetrate deeper into the communities where we know folks have limited access, may not be on a transportation route or a bike route where they can take their families. We want to have a holistic approach. And so the future is bright. We didn't talk about our services and our newcomers to look at those individuals who are coming in the county and providing the support to those newcomers and all of the challenges that we have at the political and federal state level, but still offering individuals who come in the county those support mechanisms and in our homeless space, looking at reproductive health and some of the conversations you had, as you mentioned, with our school-based health and wellness center and the great work that we're doing in our behavioral health and crisis services. And you talked about the stabilization and having the beds and really looking at providing those services and meeting people where their needs are. And we've seen that somewhat during COVID, and we want to build upon those lessons learned. So we want to have conversations like this evening. We want to have webinars, and we want to talk about education and partnership and even recruitment and retention of staff. And so we hope the Medical Society of Montgomery County can help us identify and secure those and or retain, but more so recruit clinicians in the Department of Health and Human Services. We want to get countyans who do great work, who have the education that you talked about, the education and the median income, and lessening the gap, the parity in services and healthcare for all. And we did a lot of work, and we continue to do a lot of work with our partnership and our partnerships in the community, and look at value-based access to care, which is what you're leading, and Dr. Rogers, who's not on the call tonight, is leading in that space. So the future is bright. We look forward to these robust conversations. We look forward to providing feedback from key stakeholders such as the Medical Society of Montgomery County, and we will continue to do great work, push forward, evaluate the effectiveness of those programs that we have in the Department of HHS, and strengthen and tighten our safety net. So that's my vision, and we will move forward with that vision and support.
We will get there together, as Dr. Bridges.
We will get there together.
This is just a snapshot of all of the resources, how to follow us, the crisis center, where to get information on the health department. We have I don't even know if you call it Twitter anymore, X. We have an X page. They're not tweets. I don't know what they are anymore, but you can follow us there.
Thank you so much. Are there any questions for Dr. Bridgers and or Dr. Davis tonight?
Yeah. Hi, Angela. I have one. Thanks.
Hi.
Hey, it's Diane Snyder. Hi, Keisha. How are you?
Hi.
Yeah, I miss the Chi Center. I meet the Casey, it's like, so what about volunteer opportunities? Are there places that, because I hear sometimes that there's places that practitioners can volunteer somewhere in the county. Is that a true thing?
That is a true thing. So the Maryland Medical Reserve Corps has volunteers. It's funny, I actually first got involved with the Reserve Corps back when I was a resident during Hurricane Katrina, and I went down and helped with the Hurricane Katrina effort, and that's kind of how they got activated. And so it's kind of had limped along, and then COVID happened, and that they really reactivated that. And so that's for all healthcare clinicians, nurses, physicians, NPs, PAs, and there's lots of different roles, and they have been really, really helpful to us in lots of different ways through COVID vaccines, folks who were willing to go out and do vaccines, but also to do the administrative part of the vaccines. And now we call people up to, help man a call center. There was a case of, we had a measles case, I think a few months ago. And so called on our volunteers to help do contact tracing to call folks. And we do call on people to do some volunteers to help with doing vaccinations and things like that. So there's different opportunities. I think we even have some dentists who volunteer. And so there's lots of different levels of volunteering that are out there. I can send, that's a good thing to include in the newsletter, how to volunteer. So I'll take that as a follow-up as something we can put in the newsletter. What are ways that you can volunteer in the county?
That would be excellent. And we did do some promotion of that during COVID. I think physicians need to understand that there is also a training program for volunteers. You're not able, but we had so many physicians during COVID who just wanted to go out and give immunizations. Let's set up a vaccine stop and let's just do it ourselves. Well, the reality is that there is a level of credentialing. There's a level that needs to be done by the state. And so this program allows you to, number one, be credentialed by them, and number two, to do their training, so that you'll understand how to be a volunteer. And also you're able, as I understand it, to note the areas that you would be most interested in volunteering. The Medical Society also from time to time does get contacted by the Primary Care Coalition, Nexus Montgomery, et cetera, to try to find specialists who are willing to see patients in the county. Maybe it is a unique situation, and sometimes it's also about volunteering for some of the clinics in the area, as well as an organization like Mobile Med. So there are plenty of needs, and we appreciate you asking that question. We certainly can promote that in the newsletter.
The other benefit of doing it through the Medical Reserve Corps is that it also gives you liability coverage.
Yes. So I put a question in chat, and actually maybe it was just 10 seconds premature because you flashed that slide up there with those phone numbers. But I think sometimes in a physician's very busy day and their staff's very busy day, they're trying to find particular resources, and they didn't have the opportunity to be on tonight or maybe to watch our video. So, they start trying to get through to the health department. Where do I go? And so I think that particular slide you put up there is something important for us to put on our website as well. We could certainly do that, but I'm just wondering if is the general information number, is that person particularly qualified and aware of all the services and programs so that they can adequately triage a physician's call? Or, physicians don't have the time to be bounced around from one number to another, obviously. So they want to get straight through to the right person. So I'm just wondering if that is the best number, if you really don't have an idea of who you need to reach out to.
So if you really don't have an idea, then 311, actually, those folks are really well trained to kind of get you to the right person, and you're going to, you're going to get jumped around a little bit because it's the same number that you call when the tree falls down a power line, right? And so, but they know how to triage that. I would say the crisis center line, that 240-777-4000 is also a really good way in an emergency to just like kind of cut through the chase and get me to the right, where's the right place to go for this emergency. That's the line that we use for maybe this is a measles case and I need to call somebody. That's our outbreak line. Maybe this person's having a mental breakdown in front of me and I don't want to call 911. Call 988 or call the crisis center. They can help get you connected up. I'm worried about a violent situation. They'll be the ones that can help connect you with those types of crises.
Thank you. That's very helpful. And we will post this list on our website and then make sure that it's really highlighted. So thank you for that.
I had one quick question for you, Dr. Davis. Are there any resources for patients that have health plans that don't cover mental health? I have a large number of patients who, they may have coverage, but the doctors or psychiatrists or counselors don't accept insurances anymore. A lot of them are requiring out of pocket, and the costs are, prohibitive for these patients, budgets. And so we kind of find ourselves between a rock and a hard place trying to give them access to appropriate mental health care.
There's not a great answer for that. So we don't have a lot of resources for folks in the gap. And that's a challenge. There's a small pilot program. So Black Physicians Healthcare Network has a pilot where they are trying to connect folks, up to culturally relevant care for them for mental health, where they will do some copay assistance, but that's a small number of folks. It's, it's limited. And so that's one of the things that we have been looking at in terms of how can we help support folks who are in the in-between, because it's a big challenge, especially with mental health, especially because even if your insurance covers it, it's often you have to pay up front because it's an out-of-network benefit and wait to get reimbursed. And a lot of folks who, especially if you're living paycheck to paycheck, just don't have that upfront capital to be able to pay and wait who knows how long for that reimbursement. So don't have a great answer. There's some private foundations who are helping with that now, but it's part of one of the things that we are looking at in terms of how do we help support people in the middle.
Great, thank you. Susan, you're muted.
I clicked it. Would you be willing to speak about the COVID status right now in the county? And with the increase in cases that we've seen, and the new vaccine that's come out, as I shared with you right before we went live, there are many physicians who are choosing not to acquire that vaccine. And so the supply from the health department is slim, the supply and demand at the pharmacies is significant. What are your suggestions about that for our physicians?
That is a challenge. I want to encourage as many folks who are willing to kind of stock the vaccine to have it. So what we're seeing is this transition from the government having all of the vaccine and distributing it to going back to our healthcare system, which we know is broken and doesn't do a good job of getting things to people, especially when they're vulnerable and need it. And so even us at the health department, so we have gotten, as of last week, we had gotten about 500 doses of the COVID vaccine, which we can only use for uninsured adults. We do have some for kids, but that's not a lot. We have a lot more than 500 uninsured adults in the county. And the state has told us we will get more. We don't know how much more. We don't know when, and they don't know when either. And so trying to plan vaccination clinics and all of that is a challenge. What we've seen is We had kind of this wavelet of COVID. We seem to be on the other side of it, which is good news that it's starting to come down. What the CDC is predicting is that they expect that the COVID hospitalizations will be moderate this year. But we got to remember, even if COVID is moderate, that's still stacked on top of a moderate flu season and a moderate RSV season. We're still higher than what we saw pre-pandemic, right? So even if everything is just moderate, not severe, then we're still seeing more hospitalizations than we're used to pre-COVID. And, you know, that's best case scenario. Worst case scenario, if we were to see a more severe flu or a more severe RSV. The focus of the health department, because we have so few vaccine and because it's really through private channels, is really trying to direct folks to places to be able to get the vaccine from their primary care, from their regular healthcare facility, and from retail pharmacies. So for folks who don't have insurance, they also can get it from our FQHCs, so CCI, Mary Center, Mobile Med, all have the vaccine, and they're able to give it to folks who are uninsured. There's the Bridge Access Program. The challenge is more for folks who are insured, because now you're going back to, well, yes, your insurance covers it, but they only cover it at CVS. They don't cover it at Walgreens because that's not the preferred pharmacy. So you can get it there, but you're going to have a higher copay. Or yes, we cover the vaccine, but we don't cover the administration costs. You've got to pay a copay on the administration. Or so there's all of that. You've also heard about long wait times. And so those are supply chain issues that I think will get ironed out. You know, it's like the rush for the iPhone. So everybody wants it right when it comes out. In 4 weeks, I don't think we'll be able to give COVID shots away. So, you know, I think that initial, I can't find it anywhere, I've got to wait 2 hours. I think that will start to smooth out over the next few weeks as the supply chain issues work out. And I think all health insurers are required to cover the vaccine, but they haven't updated their systems to be able to bill it yet. And so a lot of it is just waiting for that stuff to work itself out. So there's a little bit of patience that comes with it. I think folks will be able to get the vaccine. But, you know, timing wise, beginning of November, before the Thanksgiving holidays and before you're starting to travel and see family. And I feel pretty confident that by then, a lot of these issues will be worked out. I will also put in a plug, if we have any pediatric providers on the call. One area that I'm particularly worried about are our 0 to 3-year-old kids, who are insured, because most pharmacies are not vaccinating kids that young. And at the health department, I can only vaccinate those Medicaid kids or the uninsured kids. But if you have insurance and the pediatrician or family doc isn't stocking COVID in their office, I'm worried about where they are going to get it from. So I was actually in a meeting with the state this morning, talking about what are some other avenues we have to make sure that our insured kids 0 to 3 have access to get COVID vaccine.
Thank you so much for that. Any other questions? Well, we have Dr. Davis and Dr. Bridgers. All right, and one last call. Any questions?
Well, just a comment. I, on behalf of the Medical Society, I would really like to thank you for the collaboration. Certainly before COVID, during COVID, and now as we move forward from COVID, we've really appreciated the information that you shared with us. Certainly in the height of COVID, as we were trying to be an arm, a partner in getting people immunized. It was quite the experience for a very small organization to try to get our physicians in to get those vaccines. And so I just can't say enough about your responsiveness and the support that you have given. And I think this new collaboration that we have in terms of kind of kicking it off tonight and making sure that we promote information about services in our newsletter as frequently as you would like to send it. We are happy to include it. So just on behalf of the Medical Society, I want to say thank you, because it's really wonderful and valuable for both of us. I do also say that I know that many of my county colleagues across the country are not so fortunate to have such a great relationship. So thank you for being that model. We really appreciate it.
You're welcome, Susan. And I just want to end with this remark. When I think about the relationship and strengthening the partnership with the Medical Society of Montgomery County, I think about synergy. So I'll leave you with that one watchword. It's Breast Cancer Awareness Month, and Dr. Davis and I have been doing a lot of community engagement, and it was surprising when we met. Oh, you're wearing pink, as part of that awareness, but that's the level of synergy that I look forward to build in partnership with Dr. Davis and with the Medical Society. So I'll leave you with that word.
Thank you.
You guys did great work during COVID. I will again just echo that mutual appreciation. I know when I was a doc and trying to figure out how to get my vaccine, it was emails from the Medical Society that I was relying on. And I will again, on behalf of my predecessor, Dr. Gales, I know that you all were a huge supporter to him, especially when he was going through all the challenges and all the, naysayers and a lot of folks giving him hell across the county, that you guys stood by his side in support and nominated him for that award for AMA. And so on his behalf, I say thank you.
And thank you all. And I want to reiterate that we're not only partners, but consider us a resource for you, because our physicians are always looking for opportunities to volunteer and to help in any way that we can. So please don't hesitate to ask.
Absolutely. Be careful what you offer.
Yeah, right. Exactly. Thank you so much to both of you. And thank you everyone for showing up this evening. I hope you've learned something that you didn't know about the health department, and we look forward to our next meeting. Thanks again.
Thank you.
Thank you. Have a good evening.
Thank you.